A recent study has brought new hope to the field of depression treatment, offering a deeper understanding of how ketamine functions independently from traditional placebo responses and possibly paving the way for more effective, individualized mental health therapies. While the findings highlight a promising role for ketamine in treating major depression, they also deliver a sobering warning about the long-term impact of opioid use on the brain's capacity to respond to treatment, particularly to the placebo effect, which plays a surprisingly significant role in recovery for many patients. This research, published in the Journal of Affective Disorders, revisited data from a 2023 clinical trial involving patients with major depressive disorder undergoing routine surgery. It revealed that individuals with a history of chronic opioid use, those taking substances like morphine or oxycodone for extended periods, showed markedly less improvement when given a placebo compared to non-users. In contrast, their response to ketamine remained intact. In other words, while opioid exposure may dull the brain's response to expectation and suggestion, it does not appear to blunt the genuine antidepressant effects of ketamine. This distinction matters. The placebo effect is often dismissed as a quirk or statistical nuisance in clinical trials, but it reflects something real and powerful: the brain's capacity to initiate healing through belief, hope, and neurochemical responses tied to expectation. When chronic opioid use undermines this internal mechanism, it not only erodes the potential benefits of non-drug therapies and placebo-driven improvement, but may also mask the true effectiveness of experimental treatments. This could seriously distort the outcomes of clinical trials and the future of psychiatric research. The good news is that ketamine, a drug originally developed for anesthesia, appears to operate outside of that compromised system. It acts on different neural pathways, specifically the glutamatergic system, and has gained attention for its ability to alleviate depressive symptoms within hours or days, especially in treatment-resistant cases. The fact that ketamine's effect remains stable even in patients whose placebo response is suppressed by opioid exposure is both fascinating and encouraging. It means ketamine could serve as a reliable therapeutic option for a group of patients who may otherwise struggle to benefit from traditional antidepressants or psychotherapies. However, this study also issues a clear warning. Chronic opioid use doesn't just alter pain perception, it may be quietly reprogramming the brain's emotional regulation systems, dampening the neuroplasticity and adaptive potential needed for mental health recovery. The insidiousness of this damage is compounded by how widespread opioid use has become in Western societies, often prescribed too freely for chronic pain without full consideration of long-term psychological consequences. As the opioid crisis continues to evolve, the psychiatric fallout may extend far beyond addiction and overdose, potentially interfering with basic cognitive and emotional processes that underpin mental resilience. The implications for clinical research are profound. If chronic opioid users are systematically less responsive to placebo, then they might skew results in randomized controlled trials, particularly in studies evaluating new antidepressants or psychedelic therapies. This calls for more precise screening, subgroup analysis, and potentially even the development of alternative study designs that account for prior opioid exposure. More urgently, it suggests that patients with a history of opioid use may require specialized or modified treatment protocols when it comes to mental health care. On the more optimistic side, the fact that ketamine continues to show robust antidepressant effects regardless of opioid history points to its resilience as a therapeutic tool. As psychedelic and neuroplasticity-based treatments gain traction, ketamine may serve as a bridge between the old and new paradigms of psychiatry. It may not only be useful in severe cases, but could offer a reliable option when the brain's natural healing systems have been disrupted, whether by chronic pain medication, trauma, or other factors. Yet, even this hope comes with its own caution. Ketamine is not without risks. Long-term use can lead to tolerance, dissociation, or cognitive impairment. Its delivery must be carefully monitored in clinical settings, and it is not a cure-all for every form of depression. But used responsibly, and in patients who might otherwise be resistant to conventional interventions, it may offer a second chance at recovery. This study reinforces the need for a more nuanced, neuroscience-informed approach to mental health. It calls on healthcare providers, policymakers, and researchers to reconsider how medications like opioids are prescribed and to ensure that treatments for depression evolve with our growing understanding of the brain's complexity. Ketamine is not a miracle drug, but its promise lies in the fact that it works when other systems fail. And in a field where success too often depends on guesswork and generalizations, that makes it a tool worth taking seriously.